Yes, hello. I want to pick up on this question about reinfection, dropping the 3 months down to 2 months. Can you explain that in English? What have you been seeing? People getting Omicron and then BA2? What is it? Are people who had Delta getting BA2? Like, how is it working?
Thank you. The issue of reinfection is quite new, and it appeared mainly with Omicron in December, because before that, most reinfection were rarely seen. But with Omicron being so different than the previous strains, we saw reinfections. With BA2, we see that reinfection can actually occur on a BA1. So you get BA1, then you can get BA2. And within BA2, we have different substrains as well, including BA2.12.1, which is slightly different again. So the issue of reinfection is seen after 2 months. We start to see some reinfection, even though most people will not be reinfected. The current numbers, we estimate that about 5 to 10% of the current infections are actually reinfection. Not within 2 months, just reinfection as a whole since the beginning of the pandemic. But since we see some people having reinfection between 2 months and 3 months, this is the reason why we lowered the threshold to be tested. That being said, anyone who has symptoms should first get tested for COVID, that's a given, but also stay isolated, wear masks, and hopefully don't meet with people that are at risk. So that's the main difference between the updated guideline is actually, as you said, we lowered the threshold for testing from 3 months to 2 months because we see some people getting reinfected in that time span.